No longer will older Americans be denied the healing miracle of modern medicine.
Since their inception 50 years ago, Medicare and Medicaid have reshaped healthcare for millions of elderly, disabled, and low-income Americans. Today, 54 million Americans are enrolled in Medicare. 45 million of them, more than 83%, are seniors aged 65 or older. As Medicare and Medicaid and the needs of those served by these programs have evolved, research has helped the programs adapt to new challenges and opportunities to improve healthcare. Mathematica has been proud to partner with CMS since 1976, studying Medicare and Medicaid and identifying opportunities to make the programs as effective and efficient as possible. Some of our studies have included examinations of Medicare managed care, Medicaid Cash Counseling, care coordination, Medicaid expansions, and accountable care organizations. Our study of Medicare risk plans revealed that payments in the early version of Medicare managed care were overpaying the plans by 6% relative to what would have been spent for enrolled beneficiaries had they stayed in fee-for-service care. This was due to the inadequate method used to adjust capitation rates for enrollees' health conditions that heavily influenced their expected costs. Since the release of these findings, CMS strengthened the method used, linking payments to diagnoses for which enrollees were treated in the prior year. CMS and MedPAC continue to track payments to Medicare Advantage plans in order to assess payment appropriateness. 85% of consumers in Medicaid Cash Counseling demonstration states indicated that they would recommend the program to others who needed personal care or waiver services. Our research revealed that the program greatly reduced unmet needs, improved a number of health outcomes, and substantially improved quality of life for participants and their caregivers. Caregivers of consumers in Cash Counseling experienced far less emotional, physical, and financial stress. The strong favorable findings and absence of increases in fraud or abuse led CMS to make it far easier for states to obtain federal waivers needed to allow consumer direction. CMS also now requires that new Medicaid initiatives to reduce nursing home dependence through home care services offer a consumer direction option. As a result, many states have since adopted similar consumer-directed care models. Hospitalizations were reduced by 15% in the 4 most successful demonstration programs, examined in the Medicare Coordinated Care Demonstration for a high-risk subset of their enrollees, which included 18% of all Medicare beneficiaries, who together accounted for 38% of all Medicare expenditures in future years. The study identified 6 features of these successful programs that were not exhibited by the less successful programs in the demonstration. The findings provided guidance in setting requirements for participating plans and practices in the subsequent Medicare initiatives to improve care for beneficiaries with multiple chronic illnesses, and for the new care management benefit added in January 2015. Through its Medicaid expansion demonstration program, TennCare, Tennessee increased coverage of non-elderly people with incomes below 200% of the poverty level by 26% from 1992 to 93 through 1997 to 98. The insurance coverage expansion improved access to care, service use, and satisfaction with care of the Medicaid managed care beneficiaries newly eligible for the program. 424 Medicare accountable care organizations are participating in evidence-based learning systems created to improve accountability. These learning systems are helping ACOs improve care coordination and quality of care for Medicare beneficiaries by providing performance data feedback and facilitating the sharing of best practices. In the years ahead, high-quality research and analysis will continue to play an important role in helping Medicare and Medicaid effectively navigate changes and challenges in the healthcare landscape. We hope you will join us this fall for a forum on the National Health Policy Research Agenda and how it can support the future of Medicare and Medicaid.